I'm Amirh Johnson. I am a resident of Union City for the last 4.5 years. Look forward to continuing to be a resident for the future. I am a medical physicist in diagnostic radiology. I currently work for Kaiser Permanente and I support the Northern California region. Previously, I've been a physics consultant for a couple of different firms. I am also a mom of three. I have three teenagers for another month. I have a 19-year-old, 16-year-old, and a 13-year-old, two of which are currently enrolled in New Haven Unified Public School District. And I am fully vaccinated. I completed the second round of vaccination in early February, and I'm here to chat with you guys about what that looked like and why I chose to get vaccinated. Derrick.
Thanks, Amirh. My name is Derrick Richardson. I'm proud to have called Union City home for the last 16 years. Plan to live here much longer than that. This is home. I am a mechanical engineer by training, and I've spent my entire career in research and development in medical devices and pharmaceuticals. My wife and I are raising two teenage boys who are currently in the school district here, New Haven Unified School District. I'm really excited to spend some time today giving my perspective on the vaccine as a Union City resident and as somebody who's plugged into technology and understands the scientific and technical aspects of the vaccine and the COVID-19 pandemic. Also really excited to give my perspective as a Black man in America and share a little bit of my thoughts in that regard. So really appreciate the opportunity to speak with everybody today. Being really rooted in the science behind what's going on here, I have a solid understanding of the fact that getting vaccinated is our way out of the pandemic. If we choose not to get vaccinated, let's say, for example, the nation or the world chose not to get vaccinated, we have to get to this thing called herd immunity, which is basically enough people getting exposed to this and either recovering or dying so that, we're kind of at a threshold where the disease won't spread anymore. That's going to take a lot longer if we just let it happen naturally, as opposed to getting vaccinated. So I think that we can get to the end of this a lot more quickly and with a lot less trauma if we actually choose to get vaccinated. That's the scientifically sound thing for us to do. And I think that as a Black person, I feel that it's really important for us to take this seriously because we get impacted disproportionately based on, pre-existing conditions and a lot of complications with regard to access to quality healthcare and biases in the healthcare system. So I think about what would happen to me if I caught this thing and I ended up on a ventilator in a hospital. Am I really going to survive that experience? Am I going to get the best possible care? I also think about the potential for me to have the virus, not show any symptoms, and spread it to other people. When I spread it to people in my community, there's a much greater likelihood that it could kill them or put them in the hospital. So I feel a sense of personal responsibility, not just for me, but for my family and for my community to really do the right thing and take the vaccine and do my part. Amirh, your thoughts?
Yeah, I agree with you, Derrick. Herd immunity is important, not only so that we can stop spreading the virus to all people, but also so that we can have some protection for people who can't get the virus, right? You're going to have, a subset of the population that, for whatever reason, can't get vaccinated. Maybe they have allergies. Maybe they have some immune compromise issue that doesn't allow them to get the vaccine. Right now, maybe they're a kid. My 13-year-old, for example, right now is extraordinarily anxious about getting sick or being a vessel to get one of his family members sick. And I see that stress on his face every day. But he's 13. The vaccine is not approved. None of the three vaccines are approved for anyone under 16. Pfizer is approved for those 16 and older, and Moderna and Johnson & Johnson are approved for 18 and over. So I think it's really important that those who can get vaccinated do, so that we can protect each other, protect our community, protect those who can't get vaccinated, and stop the bleeding. We're over 500,000 people dead in 1 year, and that's only COVID deaths. I look at hospital data, and we have an increase in other deaths. If you look, and my daughter is an economics policy researcher student, and she has looked at data, and we have an increase in overall deaths, and that's because people are avoiding going to the doctor. People are not getting screenings the way they should. People are missing out on health care, and they're dying from other things that could have been prevented. And so we have the 500,000 COVID deaths, and then we have some number of deaths that we don't know yet, that we can also attribute to this pandemic. So I think it's really important for everyone in the community to take care of each other by getting vaccinated.